Okay, thank you. I'd just like to say thank you to everyone joining the CIH podcast, where we're going to be looking at mental health in the housing sector for this Mental Health Awareness Week. So we have a great panel for you all to listen to today of experts leading work inside CIH and with reflections from outside within the wider sector. So I would like to introduce our panel and then we'll crack right on with the discussion. So we will be hearing from Jennifer Gilder, who is Human Resources Manager here at CIH, and Louise Smylie, who is our Training Manager, who are going to be talking about the initiatives we have at CIH around mental health and how to support our staff and members. And we also have Matt Baird, who's Recruitment Director at Avalon and also Chair of the Board for St Anne's Hostel, which is part of Spring Housing. So Matt will be coming with a perspective both for staff and for customers around the importance of supporting people in terms of their mental health. And I am Sarah Davis. I am Policy Manager at CIH, and in the policy team I wear a hat that's around housing, health and social care. So I'll also be picking up a little bit of things we have done around supporting our customers with mental health and how to have that focus. So a great focus today on why it's important within the housing sector and what can we do to support staff and customers in what are challenging times with the cost of living crisis, with a housing crisis, and with so much going on around us. So what I'd like to do is kick off by just asking our panel, from your perspective, why you think it's so important to address the issues of mental health in the housing sector. And Jen, if I start with you, that would be great. Your perspective, please.
Thanks, Sarah. So I'm going to bring in the kind of insight from CIH's perspective as an employer. So I guess a little bit removed from the housing sector directly, but I guess it kind of travels across for everybody anyway. So I think, mental health is something that affects us all, and in different ways at different times. And it's really important that during those difficult times that there's somebody there to talk to. We know that talking helps, it makes a difference. And so just as we might have physical first aiders in the workplace, that we also, that deal with those physical crises, that the health and safety mishaps and things like this as well, that the mental health first aiders are there to provide support in those mental health situations.
Oh, that's great. Thank you. So, Matt, from your perspective, I just thought, what's your take on the issues around mental health and what you're seeing both in terms of recruitment and as a housing leader on the board?
Thank you, Sarah, and thank you for inviting me on today. It's a really interesting kind of conversation around mental health at the moment. There's that impact on tenants, but there's also an impact on staff, and we can't get away from the fact that the job that people who work in housing have can be a very highly traumatic role. I've talked before about how I've spoken to people who are officers, support workers, directors, chief execs, whoever it might be, who've been going through burnout. I've talked about homeless officers who say, look, every third call is a suicide call or a high level kind of mental health call. And taking on that burden is incredibly difficult, particularly in a sector in which we're trying to employ people who are doing it for a vocation, because we can't always, necessarily compete on salaries and things in the way the private sector can, but also have more demands on them than they've ever had before. Social housing by its very essence is a safety net for a lot of people. And unfortunately, a lot of people who find themselves in social housing or have been in social housing for a long time, and this is no way to generalise, it certainly isn't true for everyone, but there are mental health issues prevalent throughout tenants and people who rent and people who own homes throughout the country. And we've seen a huge shift in mindset on that for a number of years. I remember growing up, if someone had talked about mental health even 20, 30 years ago, wouldn't have been taken in the same gravitas as it is now. But there's a huge, I think, importance that we're seeing about the interconnectedness between housing, and that includes mental health. I think we've still got a long way to go. I think there's a lot of challenges people still don't understand about mental health, particularly when we talk about neurodivergence and things along those lines. But it's vital that we have a grip of understanding who people are as people, because it's very easy to go, okay, someone has got a broken leg, they're going to be incapacitated for a while. If someone says they've had a psychosis episode, or they're going through a period of depression, people are often still stuck in that, well, what do we do? And like I say, that goes for staff and for tenants right across the space.
No, that's a good point. And we use it also as a catch-all term, and actually there's a huge range of issues coming under that banner term of mental health, and so we do need to think about the appropriate kind of interventions at what level. So I just wondered, I'd like to come back to Jen and Louise to talk a little bit about why CIH has you touched on it, Jen, that we have mental health first aiders, and I just wanted to touch on why CIH has implemented that and what's the role of a mental health first aider. So perhaps I could come to you, and then I go to Louise in terms of, well, what does that mean in terms of the skills we need to have? So Jen, if I could come to you.
So mental health first aiders, it was a really important decision that we made to implement that role in the workplace. I think mental health is something that affects all of us at different points in time, and we all have different ways of dealing with it. But knowing that there's someone there to talk to in and around your workplace is really important. We know that talking makes a huge difference. If you can share your problems. The evidence is there to support that, but we know it in ourselves as well. So just as the physical health first aiders are there, we also have the mental health first aiders there to support in everyday situations and in crisis situations as well. So as an employer, that was an investment that we wanted to make in our colleagues and in our welfare support that we offer here at CIH.
So what do you think? What do you think they can do to help organisations, reflecting on what's happened at CIH, but also just in terms of what that role means? Why would a housing organisation maybe think about mental health first aiders, perhaps?
Yeah, I mean, if we touch upon the role of a mental health first aider, it's about recognising those signs and symptoms of mental health, so that we can get in there early and support people, so that they're not struggling alone. And really, mental health first aiders is that first level of support. You're then signposting and supporting them on to access, professional advice, and it just provides that confidential listening ear. And if without that, it's quite a lonely place to be. So as an employer, we know that if people feel supported, feel that they're part of a community, feel that people care, they're going to be a lot more engaged, a lot more confident in the workplace, a lot more comfortable in the workplace. So all of those things make a massive difference.
No, that's great. Thank you. And Louise, can we just touch on what kind of skills and experience you might be looking for, and what kind of training you would give to people to equip them for that mental first aider role?
Certainly. Thank you, Sarah, for the question. I suppose with just as Jen has said with regards to CIH, we identified that there was a need, and it's very much welcome that the initiative was rolled out for colleagues to, if they felt that they wanted to help in terms of being mental health first aiders, that it was an option that we were able to avail of. The training itself, it's certainly it's an ongoing process. There was an intensive 2-day, sort of almost an introductory, but by no means, that is its start and stop, and that's you fully qualified. It was just an introduction, more to actually, I suppose, dispel any taboos, just the way Matt's saying about, people with psychosis who actually don't know some of the terms, we don't even realise what it is. And it's almost an opportunity to overcome the queries or the questions, the taboos, to dispel any myths, and actually to realise that it is very much a real life thing that people are living with. And if we can dispel it and bring it into our everyday conversations, as we do in CIH, it means that folk are more likely to reach out and speak to someone. We're not trained counsellors, that is not our position. We are just a lending ear. If somebody wants just someone to speak to anonymously, quietly, whether it's over face-to-face or it's over Teams. So we are a remote working organisation, which we recognise. So therefore there can be sort of stints of loneliness where people feel that they're on their own. And whenever that happens, sometimes your thoughts can spiral out of control. So it's really wonderful that in CIH we promote the mental health first aiders and all the initiatives that we do. We have different we put different events on, whether online and in person, the likes of Coventry, just so that people sort of start to talk. I think the main skill is just to be approachable, and there's a non-judgmental aspect to it, to the training that we've received, so that we know that people can come in confidence, and they know that even if it is just someone, just they will be received and they will be able to talk freely without any sort of fear or judgment, I suppose.
No, that's really useful. Thank you. Are there some examples of some of the, because I know you've encouraged people to get involved and connect with you, and some activities. I wondered if they just had anything interesting come from that, or how is it progressing, I guess, growing and embedding you as first aiders, mental health first aiders within CIH? What's your take on that?
I would say that some of the main initiatives is just the reinforcement of the positive message that we are here, and we are here to talk. We are available for people to reach out to. For example, every couple of weeks we release a poster for the mental health first aider of the week, and it gives a little bit of a breakdown of the person, the team that they work within, maybe what you do outside of work, what your hobbies are, things like that. If you wanted to be a superhero, who would you be? That sort of thing. And it's almost just to bring us back down to the human level, that we are just like everyone else. And because our mental health first aiders are from across all of CIH. I work within the Housing Academy, but we have mental health first aiders from across every single department and every single job position almost within CIH, that it means that we're relevant to each and every one of the people who may wish to reach out to one of us to speak to us. So there's that there. We do also have some events that are face-to-face. I know that at Easter time there we had an egg hunt in the Coventry office, which was very well attended. I think it was a stampede to get in on the day, and it was very well received.
No, that's great. Jen, did you want to come in?
Yeah, just to add, I mean, it's anecdotal, because obviously part of the service is that it's confidential. So, without sharing individuals who have come to us, I can say that, people are taking those opportunities whenever they're seeing us in the office, they're coming in and finding us, or seeking out individual mental health first aiders. And when we've run those events like that activity that Louise spoke about there with the Easter egg hunt and others, people are just, the feedback is how great is it that CIH is invested in this, and that they know it's there. They might not need it at this point in time, and that's fine, but they know that it's there, or they know that it's there for their colleagues, and they really see that as that's part of our culture, that we want to invest and support in mental health and well-being, and that's who we are as an employer.
That's really useful. Thank you. Matt, I'd just like to bring you in at this point. And I mean, I'm not sure in terms of your experience where you've had sort of direct experience with mental first aiders, or if you've seen any sort of intervention like that, and what you see as the benefits, both in terms of staff, but also, with your role with your hat on as a chair of a board, where you see that filter through for your customers.
Yeah, I mean, I think anything with mental health first aid, the challenge I think that some businesses have had, and we're getting better at it, I think, as a sector, is that the term mental health first aider came out, but we didn't relate that to a first aider. So what we did was said, okay, we've now got someone in the business who knows everything about mental health. So if I have a question, I'll go and tell them, and they'll be able to fix anything and everything, rather than going, well, no, like a first aider, you'll have a basic understanding of how to initially support and help, and then take you to where you need to go. Now, obviously, it's not a hospital or A&E or whatever we're doing here, or whatever it might be, but it's that initial kind of response, and that initial kind of, look, here's someone you can talk to, here's someone you can have a conversation with. This doesn't mean that we're going to be able to fix your mental health overnight, but it's that stepping stone. And I think what's really fascinating with the sector more broadly at the moment is you are noticing cultural differences across the sector in terms of the way that we're engaging with and supporting people with mental health, there are still businesses which, I have a number of confidential conversations every single week with people from, like I say, frontline staff through to execs who are firmly, saying to me, actually, we're burning out here and no one cares, or we are really struggling with X, Y, Z. And I've tried going to my manager, and because they don't understand it, they don't know what to do. So it's just kind of ignored and said, hey, we know you're having a nightmare time. Do you just want an extra week off? Cool, see you in a week, and come back and nothing has changed. But, well, we gave you a break, so we've done our bit kind of mindset. So having people in the business who can at least also guide and advise managers and directors in terms of, look, I've been on a course. I'm not saying I'm a fully fledged expert of everything, but I'm letting you know that actually that isn't going to work here. We need to have a think about culturally how we're going to support and change, but also this individual, what support they're going to need, because there's nothing worse than hearing stories of housing officers, managers, directors, people that are working out in trade opportunities and those kind of roles as well, who are going out and engaging with our customers, who we know are going through significant mental health challenges themselves. Something finally snaps because we haven't given them enough support as a colleague, as a member of staff. And then suddenly there's an incident with a customer, or there's an incident around, members of the public, that somehow then that person gets additional blame for, despite the fact we know they're struggling. And yet we're putting them in environments which are high stress, high need, high dependency, and still expecting them to perform. And it's a really difficult balance. The sector is, like many sectors are, built on real hope and faith that people are going to do as many hours as they can possibly do for as little as we can give them. So you might be on a 35-hour-a-week contract, but quite often people are going over their hours because the work needs doing and we're doing our best and we're going to try and hire more people, but you can't always do it. Someone's left, whatever that might look like. And then people are just taking on more and more and more because they care so much, because they want to do well, because they want to look after people in the best way they can, or they want to run the best sessions, or they want to make sure that, in a CIH perspective, people are getting the best event they possibly can, or getting the qualifications they need in the best way, or whatever that might look like. And yet the pressure is higher than it's ever been. Mental health is tauter than it's ever been, because also I believe people are more aware of mental health now in terms of their own mental health is far more aware, rather than just going, okay, stiff upper lip and get on with it. Well, actually, you don't have, the media is telling you don't have to be that way. Go and get support, go and do this, go and do that. But if you're in a business where that hasn't been the case, you kind of feel like you're even more trapped. So it's brilliant to hear about the mental health first aid work going on with the CIH. As I say, it's just about, I think, those utilising it and the message it's sending out, which is, look, this is like having a first aider on site who might be able to do a bandage or a sticking plaster or whatever else. But if you break your leg, they're not going to be able to reset it and fix it and wrap it in a plastic cast. This is just the first stage of someone there as support for you. And we can help you get the rest of the support you need. And I think sometimes I've seen businesses which kind of go, we've fixed mental health because we've got 2 mental health first aiders. We're good now, right? We're doing everything we possibly can. But it's brilliant to hear Louise and Jen both say, it's very much the start of the journey. It's very much, this is always going to be learning for our first aiders too. We can be very much learning about how much more there is to take on. And at the end of the day, our mental health first aiders are only human themselves, so they need support as well around it. So it's a really fascinating area. I think it's brilliant to see what's going on at the moment. I just hope that businesses more widely in the social housing space kind of go, actually, this is something we need to pay more and more attention to. And as Louise said, just because we've hired a mental health first aider doesn't mean we suddenly fix the problem.
I think there's a lot of good points you've made there, actually, Matt. And I do think that obviously I'd like to go back to the point about the fact that people work in the social housing sector because very often they really care about being involved with people, making a difference to people and communities, and that's why quite often there is that commitment to going above and beyond. But I think what I'd like to pick up with you is, do you feel, and I suppose this is particularly from a CIH perspective, several years ago we had under the kind of leadership of our then president Aileen Evans a real focus around mental health, and we did a work on Spotlight on Mental Health where we looked both at sort of staff, but we also looked at, we know that our staff are encountering people with a lot more problems, complexity of problems, cost of living is a real squeeze, and a lot of people may be there in our homes not asking for help, and we developed kind of a support to say, right, at different points of a person's tenancy journey, these are some things you might want to think about. These are the things you might want to talk about to them. These are things to think about if you're not getting any kind of contact when you're trying to talk about rent arrears, and giving tips about how to support tenants with mental health. And I wondered really from your perspective whether you feel that staff facing the public, facing our customers, feel equipped, or whether there's still a need to look at what further support staff might need. What kind of things do you hear that people are coming back with, saying, I've been out in my community, in my neighbourhood, and this is coming up, and I can help people with tackling rent arrears. I know how to talk to them, but I'm not sure about this. And I'm just wondering what you might be getting from people on that.
Louise, do you want to jump in first, and I'll come in after? Please do.
Just very quickly, it's very interesting sort of opinion or question, Sarah. I've been in my position for 7 years, and I've been within CIH for 7 years, and over the last year or two there has been a real increase in the amount of interest and number of training requests in and around mental health and how to support tenants and how to support tenancies to sustain tenancies. This is something that we would never have had 4, 5, 6 years ago. So now I think that, as Matt had said previously, I think in the past people sort of said, oh yes, we've brought in a mental health first aider, we're all trained, that's us, good to go, that's us, we've ticked that box. Whereas I think that almost organisations and customers that I work with, certainly, we're seeing they're actually realising the depth and the significant need to take this very seriously. And it's not just we've ticked the box, we've delivered one training session on mental health and how to talk to people. It's an ongoing thing, and it's about embedding the mental health, that it is the core. Housing is at the core of people's health and well-being, and it's embedding it, and it is just continuing to develop it and to remind people that it isn't just a box ticking exercise. It is an organic thing that will grow, and it will take different avenues, and it will sort of manifest in different ways for different departments. Within an organisation, I deal with housing officers who are at the front line. I'll also deal with their managers who are looking at it from a different point of view, and they're all juggling different balls and facing different challenges. But there definitely has been a massive change or a massive shift in the attitude, and that, right, okay, this is something that we really do need to invest in, and we need to look after both our colleagues and our residents to sustain tenants, so that then it's actually positively moving forward, rather than just sort of oh yes, it's sort of quite popular and trendy at the moment, so we will tick that box and put a badge on our, at the end of our signatures, that sort of thing. So there definitely is. I certainly I work within CIH, but I also see it from the sector's point of view, so that I can see that there's definitely a massive change in attitude, and people are taking it seriously, and about time too.
I think for me it's a real interesting balance at the moment. It's exactly what's kind of been brought up already a little bit between, and I think it's the biggest challenge the sector has. We're almost pivoting to a stage where suddenly we're now, if someone mentions mental health, suddenly there's almost a fear or a panic or a worry amongst managers or HR teams or whatever it might be in some businesses, because they're going, oh God, right, well, we have to get this right. We have to make sure, because we can't be seen to be a business that doesn't care about mental health, and there's panic stations, there's everything going, without always just talking to the person about, what is it you need? But then conversely, on the other side, you've got managers, just much as Louise mentioned there, going, look, I've got a team of 6. We are tight as can be in terms of to hours and workload. If we have one person off, it's tough. We've then got someone coming in and saying, hey, look, I've got severe depression. I'm going to be off for 2 months, or I've got this and I'm going to be off for a few days, whatever it might be. And not knowing how to manage that in terms of timescales and timeframes and how that might come back, and going, well, actually, do we need to get a temp in? What does that look like? Can we afford an interim? Because it's still so unknown, because we're still learning. Unlike health, which we've all been through, everyone's known someone who's broken an arm, leg, whatever it might be, had to be off work because they've damaged their back for a bit, whatever it could be. everyone's journey in mental health is very, very different. And as much as recovery times of physical health is there, someone's got an infection, whatever it might be, mental health is so broad that managers, directors, other people HR teams who are meant to be expected to solve this and to fix everything and to go, okay, yeah, well, look, this is what we're going to do. We're still very much in the early learning stages. As Louise mentioned, 5-6 years ago, this wasn't really even on the cards. This wasn't a conversation. But conversely, there is definitely legs to the argument that, and potentially, I guess, controversially, Britain and people in more general have lost some of their resilience. Have lost some of that kind of, I'm just feeling a bit rubbish today. Today's just a bit of a blue day, whatever it might be. I'm struggling a bit. Britain has still been built on that thing of going, okay, well, if you're not quite in the right headspace, if you're not 100%, you've still got to go work. You've still just got to go and do it. You've got to crack on. We've got to get through the day. Now, that's not necessarily healthy, but it is necessary for the workforce. And that line between the two is really, really difficult to manage for teams, because we want to be as supportive as we possibly can. We want to give people as much leeway and room and knowledge that it's a safe space and knowledge that you've got as much support around you as you can possibly want. But you've got that because you've got a job here and because we've got a work needs doing and because the role needs doing. And that line between the two is so difficult. And I don't think we really give always enough credit to just how difficult a line that is to walk and to get right, because quite often you can't get it right because there isn't a right answer. And so when I'm looking at the sector more broadly, and when I'm looking at, from a recruitment arm and from a chair arm and from the roundtable and other bits I talk to, and I think so often the conversations that flow are that people really, really want to get this right, but aren't quite sure what is right or how to at this stage. And I mean, I've never had to manage it from a HR perspective. I don't envy Jen in the slightest. With some managers coming to you going, look, what do I do? And there's a reason that sometimes we're still just trying to figure it out as we go along, because we're still very new in this journey. Like I say, I went to school, a few years ago, like 20 years ago, whatever it was, 20 more years ago. And, when you have those conversations, when you think back, if I'd heard, so-and-so's dad's off because he's got depression, you'd immediately go, God, what's wrong with him? Now it's, oh my God, are they okay? But we're still so new in that journey that our managers and our execs and our directors and people who've been in the workforce for the last 30, 40 years gone, well, look, I was all right. I just had to get on with it. I got through it. Yes, okay, it was rubbish at times, but I got through it. The work needs doing. Let's crack on. And they're trying to shift their mindsets as well to help, but while also being, why can't people just get on with it? And that's a really difficult line to tread.
I think that's a good point, actually. It is a balance, isn't it? And very often, I think sometimes as managers, and Jen, I don't know whether you'll have any reflections on this, you are keen to try and make sure that you're supportive, and almost you're there trying to give the answers instead of having that kind of like discussion, because sometimes when you have issues that are wrong with you physically and in terms of mental health, carrying on as much as you can is a good thing to do. It's just that you might need that extra support, and it's not about an answer being presented to you. It's about how you might negotiate what's the right way forward and how you do that. And I think it is still a learning experience and a bit of walking that out with people in as they go through their issues. I don't know, Jen, whether from a housing human resources perspective, whether you'd have any further reflections on that.
I think you're absolutely right. I think it's we're not going to get it right all of the time. Like that's it. We're all kind of, and that's not going to go away. That's a forever, right? That's the way that we continue on. We just continue learning, and but I think to kind of dial it back, there is always a balance between what the business need and a policy and working with that individual. But I think if you can have the conversations with that individual and be quite person centered about it as much as you can be within the realms of your business and within the realms of the policy, that's probably, in my experience, the kind of the starting point, and then where it takes you from there is going to unfold depending on the individual circumstances. There really isn't a one size fits all. What I do know is that the more we kind of talk about mental health and the more we make it okay to talk about mental health, the more conversations there are going to be. So we need to upskill our managers. We need to make sure the policies are there to support. We need to put in place the employee assistance programs, the mental health first aiders is part of a package. It's not all of it. We've said that, it's more than that. It's great and it's amazing that it's there, and it's something I would absolutely encourage businesses to invest in, but it can't be the end point. It needs to take into account everything else that can be offered, and actually a big part of it is preventing somebody even getting to that point of, mental well-being is also important, like what keeps me well, rather than like just dealing with the situation once it gets to more of a crisis. I mean, that goes slightly off the point there, but I think, yeah, it's tricky. I'm not going to lie. It can be very, very tricky for managers, for HR, for the individual to kind of navigate it. But I think if you show that you're doing your very best to listen to that person, to support that person, to be there for them, and your intent is right, then that's going to go a very long way. And it sometimes involves difficult conversations, and there's no getting away from that as well.
I would have said, actually, Jen, it is exactly the point. The thing you raised there about what we want to talk about is mental well-being. We've, in terms of when we look at when we talk about housing being part of that building blocks for life, we are talking about the positive experience that you can have from decent, good housing in a safe neighbourhood, connected to green space, connected to employment and education training. It's a foundation stone for well-being, and when it goes wrong, you can see the impact it can have on various elements of your health, and of course mental health is that. So a positive attitude about, what we're trying to do is build good communities, build good homes, build supportive services that actually do help people thrive in local communities. So even within the working community, within our staff, absolutely, it is about trying to work out what supports well-being and helps people identify at an early stage where they might be going into some point of difficulty and how to address it. I just wondered there are a couple of things I think still really love to hear from all of you on, and one's a positive and one's a negative. So I think I'd like a sense of where you think we are in tackling the stigma that there's been around mental health, and do you think we're in a good place on that? Or have we still got quite a lot of work to do? And I'm reflecting on the fact that Mind and etc. A lot of charities have done a lot of work around the stigma of mental health, and we are talking about it more. And then the other thing I'd like to hear from you is, what's your number one tip for people in this mental health week about supporting their mental well-being, or if they're struggling, something to do this mental health week? So a negative, where are we at stigma? Are we making inroads into that? And what's your top tip for this week for people? So I don't know who wants to take the plunge and go first on that. Louise?
I'll go first. I think with around stigma, we're getting better, but we're not there yet. And I don't think we ever will get there. I think it will continue to evolve and change, because mental health is such a personal journey. And it is so personal to each and every person, and how they deal with it and how they manage it. I feel that it's as unique as your thumbprint. You cannot sort of put it in a box and say, right, that's it, sort it out. So the stigma, with regards to the stigma, as I say, I have seen a fundamental shift in the sector attitudes over the last 7 years since I've been with CIH, and I welcome every last conversation that we have. It's fantastic, but I think that we will be 5-10 years down the line, we'll still be having these conversations. But I think we are getting better, and the speed at which we are getting better is increasing. So I think it's a negative but a positive. And in terms of a tip as to what to do, that nothing beats just taking a break from the screen, whether it's going and cuddling your dog, walking outside for 5 minutes, just going and taking a break for 5 or 10 minutes, and then things will always look a little bit better. Very simple tip, but very effective.
Thanks, Louise. And Matt, Jen? Matt, go ahead.
I'll dive in. I think on the stigma side, it's going to continue to be a real difficult challenge when it's becoming so politicized. I think when you've got, stuff from across the pond, US health secretary, etc., saying stuff like, autism is curable and things like that. Now, I'm not saying autism is a mental health concern, but it ties so closely to other mental health concerns that quite often you see the relationships between all of them. I think so much of it now comes down to social media and where we're getting that information from and the insight from and everything else, that I unfortunately agree with Louise. I don't think it's going to get better. What I do think is that a lot of people want to improve their knowledge and understanding of it. I think there's a big shift from HR teams, and you can tell from the culture of a business, whether or not they care about it. But as Jen mentioned and Louise has also mentioned, we're so early on in the knowledge and understanding of what causes these and why they happen and where it comes from, etc., that realistically we're a long way into that journey. And I do still unfortunately think that if someone says, one of my colleagues has broken a leg, they'll be off for a few weeks. They're like, okay, well, I get that. If someone is unfortunately, they're a bit depressed or whatever it'll be at the moment, or they're facing a mental health crisis at the moment, say, well, can I just come in and get on with it? So there's the line between the two. And then in terms of the top tip, I think this is more difficult, and this is nothing at all against CIH in any way, but it's very, very difficult when you're working as a remote team to notice those little things with your colleagues, that slight shift in behaviour, because it's very easy to mask for half an hour on a Teams call. And then, you go and deal with what you deal with when the screen goes off. So I think it's about those ways of just doing what we can to bring people together a little bit more, particularly if you are a remote or hybrid working team. What can you do to have more days, more time where you can bring people together? Yes, okay, maybe not in a fully compulsory way, but in a way in which you're understanding and sharing, so you can just pick up on those little bits. Because there's tips like, always ask, are you okay, twice, and there's all those things which are great, but it's about really knowing someone and having their trust. Because if you have got something that you're struggling with, you're relying on them telling you, and if there's no trust there, they're never going to in the first place.
Absolutely good point there. Jen, can I come to you for your final thoughts on it?
Final thoughts, yeah. I mean, some really great points there. I guess I may be a little cup half full in terms of the kind of the stigma. I absolutely think there's a long way to go. And as much as I think we've addressed some of it, when somebody's off with mental health issue, they often think, because they tell me, I'm worried about my job, or people might think I'm not capable of doing my job, or things like this. And so I know there's more to do. However, the conversation is there, it's starting to happen. I guess that's the bit that holds, a little bit more optimism for me, that those conversations are there. People are really interested and engaged. When we run training sessions, it's a subject matter that people want to be part of and want to sometimes training is quite a tricky one to get people interested in, but anything around mental health, we do get that interest. So from that angle, I think that's a positive trajectory. Like I said, we're not there, but we're moving in the right direction. And I guess in terms of the my kind of biggest tip, it links to that idea of talking. I've said it already. I think just talking to someone, there's always going to be somebody there to listen, whether that be a friend, a family member, a work colleague, a mental health first aider. Your Samaritans, there's and it doesn't need to be a face-to-face conversation. It can be text, it can be phone, it can be messenger. There's all sorts of the technology's there to support as well. So as much as technology can be a little bit barrier for that remote working, like Matt picked up on, and as mental health first aiders, you are trained to think about that and how you identify some of those signs and of perhaps poor mental health virtually. Technology can also be an inroad for some people. Like it opens up other options to talk, to have that conversation, and to hopefully seek some help.
Thank you very much. I think that's been a really interesting discussion. I'm sure there are lots of other questions that people listening to us could have thought of, and that we might explore maybe at another time as well, as we carry on with this developing our approach to supporting people in terms of mental well-being and mental health. I just wanted to, I suppose, a little bit of a plug to remind people that we do have those tools for staff around Shine a Light on Mental Health. They're still there for you to look at, a guide to how to to support tenants, but also a reflection on workforce issues. Do look into the really useful tool that is Mental Health First Aiders, and really appreciate that we have a real complement of dedicated staff who take up that role for us and are there for us to talk to. And I hope you've enjoyed this discussion around mental health in the social housing sector. It's touched on quite a range of things, and I hope also that you'll take advantage of this Mental Health Awareness Week to look into what other tools there might be available, and get some support if you yourself need it. But thank you very much for listening to this latest CIH podcast, and we look forward to talking with you all again on the next subject. Thanks very much.